In the United States, reported cases, infection, hospitalization, and deaths continue to decline in the United States. This is the pattern that we have seen in the northeastern state. It's spreading across the United States, and we project in current projections that this will continue all the way till the end of September, where we are expecting another wave due to seasonality and waning immunity. We are concerned in the United States because of the fastest spread of BA.4 and BA.5. It's an escape variant. It seems from the new studies that we are looking at that the vaccines are less effective in preventing infection of BA.4 and BA.5. They are still very effective in preventing severe illness and mortality. But we are concerned that with the BA.4, BA.5 spreading fast, with the relaxation of mandate and with the patterns we are seeing in some European countries where there is a third wave, we are concerned that there is potentially here for another bump or an increase in cases in the coming months. We will update our models first week of July, most likely the second week of July, and we will include all this new information in our models, and we could then predict if we will see a third wave or not, and how big it will be and how long it will last. In general, we're heading into the right direction in the United States. We're expecting a surge in winter, and the focus right now in the United States should be on, of course, vaccinating people and getting the booster, and then, of course, getting another vaccination before the winter, especially also with flu. We expect that flu season could be bad because we haven't seen flu in the past 2 years. So again, our recommendation would be take another COVID-19 vaccine before winter and a flu vaccine. Also for every state to secure enough antivirals in order to make sure they are provided to people, infected people, especially those who are at high risk, elderly and people with immunocompromised or with risk factors, chronic conditions, to make sure that we reduce the burden on our hospitals and we save lives. And of course, continue screening and making sure that we don't lose track of what's circulating in our country. And if there is an increase in cases due to another variant or to a pre-existing variants, we take the measures that are necessary to stop the spread of this virus. On the global level, what we are seeing right now is a rise in some European countries. So we see a third wave driven mainly by BA.4 and BA.5 and the relaxation of mandates, increased mobility and low mask wearing. We see this third wave increasing number of reported cases. And we see it in France, in Germany, beginning of it in the UK, in Greece, and Israel. And that's a big concern for us because what has happened before in Europe has happened here in the United States. And we could see here in the United States potentially a third wave, especially from BA.4 and BA.5 that are increasing in the United States as a percentage of the variants that are circulating. And we know right now from several studies that previous infections from other variants do not provide as much immunity against Omicron and BA.4 and BA.5. And also the vaccines are less effective in terms of preventing infection. They're still effective against severe illness and mortality for BA.4 and BA.5. So putting these two together, we are very much concerned that we could see potentially in the United States another wave after the second wave due to BA.4, BA.5, relaxation of the mandate, increased mobility and low mask wearing. We will update our numbers in July, most likely the second week due to the holiday. And then we will take into account all this new information about the spread of BA.4, BA.5 in Europe and the new studies that are showing less effect of the vaccine against BA.4 and BA.5. China remains a big mystery for us. We don't know what's going to happen in China. They're successful so far in containing the virus, but as soon as they change their policy and open up the country because they have less infections because of their success before, and their vaccine is not as effective, and also many of their elderly population is not vaccinated. So we could see a rise of cases in China as well.